everyone. So happy to have you all here with us. I am Jacqueline. I am a recent medical graduate from India. I am the social media manager for Project IMG, and we are very excited to bring this new series of webinars with residents, where we want you to be able to ask your questions directly from residents, since they are already on the other side of the journey. And all of us, including myself, we are still on this tedious and daunting journey. So it always helps to get some advice from people who have already been in this journey and are on the other side. So if you guys are familiar with Project IMG has been trying to help IMGs navigate their USMLE journey from the past 4.5 years. So just taking that a step ahead, we wanted to bring something that can replace that can be a sort of direct interaction with residents, or especially people who don't have much connections, who don't have anybody to give them guidance. And sometimes we all feel a little bit clueless about exams, resources, USCE, other parts of the application. So through this webinar series that we have with residents, we just want to tackle everything one step at a time, so that we can help each other out and solve our doubts. So without further ado, I'll pass over the mic to my co-host for today, Lakshmi. She'll tell you more about today's webinar.
So greetings everyone, I'm your co-host Lakshmi. I am one of the committee members of Project IMG. So, first of all, thank you for joining in for today's webinar brought to you by Project IMG. So we are incredibly fortunate to have Dr Usman Sadiq in IMG from Pakistan, who is currently a PGY2 resident in internal medicine at NYC Health and Hospitals, Harlem Hospital in New York. So today, Dr. Usman will walk us through an overview of the USMLE, US clinical experiences, the residency application, interview preparation, and of course, networking. So, and then we'll conclude with an engaging Q&A session where you can ask him your burning questions. So without further ado, Dr. Usman, the floor is yours. Thank you for joining us today.
Thank you, everyone. Thank you. It's been a pleasure. So, yes, thank you for the introduction. I'm Dr. Usman Sadiq. I'm a second-year resident in internal medicine at Harlem Hospital. It's a public hospital. It's a community hospital affiliated with Columbia University here in New York City in the US. So today we'll discuss about, I just give you a gist. I try to keep it brief. I hope that, I don't want to make you all bored or something, but I hope we'll keep the session, I present the entire presentation, and in the end we'll be open to any questions that you have. So let's just start. Again, I'm an IMG International Medical Graduate from Pakistan. The purpose that I'm actually doing this is because I've been in your shoes 2 to 3 years ago. I was in the exact same shoes where you are right now, looking for guidance, because I know Jacqueline and Lakshmi rightly said, it's not because we come from different medical schools, we come from different places, different institutes, so it's not always that we have a strong alumni or a strong a brotherhood of some sort. So it's always good to interact, always good to connect, and connections do make a huge difference. So without further ado, let's just start our presentation. So again, number one, it's the guide to residency in the United States of America. So first thing you should all know is that I'm sure that all of you are really looking forward to start your residency in the US. You want to match, and without any doubt, it's a huge task and it's 100% accomplishable, but you should first know what are you delving yourself into, right? So we'll start with the structure of the residency. So this is just like an overview of what you can expect. Again, please keep in mind this, the structure that I'm sharing is internal medicine, and it's at a busy hospital, at a busy public hospital like Harlem Hospital. So obviously there can be some plus and minus, but it depends on what kind of residency or rotation you're in and where are you currently. Again, where do you match or where do you start your residency? So number one, as a PGY1, also called as an intern, your usual rotations. So there's I'll divide the rotations into four parts. Number one is the floors, which you call general medical floors, or what quote unquote ward. That is what we call back home in the subcontinent. So this is like you're usually either on short call or a long call. So you can have at least, I would say, long call. You're on long call 2 times every week. Otherwise, you are on short call for 4 times, like 4 weeks a day would be short call, and 1 or 2 days you would be on long call. Short call is usually from 7 a.m. to 5 p.m., whereas long call you have an additional 2 hours, so that makes it from 7 to 7. Then you have your ICU, CCU rotations in first year, again, depending on what type of program you're in. ICU means intensive care unit, CCU is critical or cardiac care unit. So that again, those are 12-hour shift. And then we have night float or night ICU, depending on how many weeks you have. They're usually anywhere between 2 to 6 weeks. It's usually that floats you do more as an intern. Night ICU, it's like 2 weeks. Some places might have it up to 4 weeks, or some might have it a week or none at all. Again, this is from 7 p.m. to 7 a.m. So this is 12 hours, but you start at night and you finish in the morning. And lastly, Harlem Hospital, like all the others, other New York City health and hospital, the public hospitals here, we are following the traditional 4+1 method. So what that is essentially is, so as an intern, as a first year, you have 4 weeks of your regular, like you can either be on floors, you'll either be in ICU, or you'd be doing your night float or night ICU or CCU. And on the fifth week, you will have your clinic week. So what clinic week is, and now it depends. Different locations have different rotations. Like in my program, we keep rotating in different clinics, and like it's like from 1 week. So you have an AM clinic, a morning clinic, and then a night clinic. So that is usually 9 to 5, 9 a.m. to 5 p.m. after 4 weeks of either floors, ICU, or night float. Just a second. Okay, so now your daily schedule, again, briefly to summarize, number one, your day starts in the morning. So usually, again, this is my focused on my program, very similar to all the other public hospitals and even the other private programs that we have here in New York or in the entire US. The sign out starts from 7 a.m. So what sign out is, you're taking the sign out from the night team to they'll let you know what all the updates are, what you need to do. Then you pre-round, that is you, the residents themselves, they're pre-rounding. You're supposed to see your patients. That's usually between 7 to 8. Now it's up to you. If you want to come before 7, you want to come at 6 or 5, well enough, good enough, as long as you're getting the job done, right? Then your morning report, this is again all of everything in any ACGME certified program. You have to fulfill the criteria to ensure that your program continues to be affiliated or accredited with ACGME, right? So the American College of Graduate Medical Education, it has made mandatory that you have a morning report that is from 8 a.m. to 9 a.m. At my program, we divided into something called a Harrison's Club and a case report. It's very interesting. It literally, so what you're essentially doing is preparing for your board exams, which you're supposed to take after residency. Then we have our rounds every day, again, because the best thing about the US is that there's a structured training program, right? So at every step you have supervision because you are being trained. This is a training program, right? So the attending, you start rounding with them. Usually it's between 9 or 10 a.m. and then you round till 12 p.m. because from 12 to 1, again, ACGME has mandated that you have something called a noon conference. It depends on what type of, again, you can have MNM, morbidity and mortality. It varies from institution to institution, but the purpose over here is that this is your this is something like you have a dedicated education time. So this is time for your self-education where you're preparing for the boards or you're studying, not interacting with the patients at this time. Ideally, obviously, if you have an emergency, so you can be exempted from it. Then, as an intern, what you're expected to do in the evening, this is after you're done with your noon conference, you ensure that the orders that your second years and especially like your second years are have put in or you've put in, ensure that they are followed. Then, most of the time after your rounds, you're done with seeing your patients, you've had a plan, you have your own assessment, you've discussed the plan with the attending. You're expected to chart. Now, charting takes a lot of time. There are a lot of because again everything is on the EMR over here, so there are a lot of tools that can make life easy for you. Once you start residency, you'll get used to it. Then new admissions. So new admissions, usually if you're on short call, you're expected to your team, quote unquote team. Again, it varies from institution to institution. At Harlem Hospital, we have like 5 teams on the floors. So a short call, you take admissions until 3 p.m. and then from 5 p.m. all the other extra admissions, additional admissions, the new admissions that are being admitted from the ED to the floors or to the ICU. Rather, the floors you take it to 5 p.m. But if it's in the ICU or CCU, you're expected to take again admissions until you're there till 7 p.m. And then essentially you're discharging your patients during this time too. Lastly, sign out. So sign out when you're short call, you end your day at 5 p.m. and when you're long call, you end your day at 7 p.m. So 5 p.m. you sign out to the long call team, especially if there's something urgent, something sensitive, something emergent, something that is very time crucial or time sensitive. You tell the long call team, they'll take care of that. And then the long call takes again, gives the sign out at 7 p.m. This is for the night team to tell, especially they share about the long call admissions and they let them know what to do overnight. And then from then again, we go back from 7 p.m. to 7 a.m. is what the night team is taking care of. Now, the process. Now, this is one slide that summarizes what the entire journey is about. Again, you start with you take your USMLE Step 1, which has recently, or I think it's been more than a year now that it has been made pass fail. First, it used to be score. Back when I took the exam, it was scored. Then you have your USMLE Step 2 CK, which stands for clinical knowledge. Like you all know, since the COVID pandemic, the Step 2 CS, the clinical skills, that has been suspended. So to date, they've still suspended the exam. Then the third thing that is important is your USCE, also called United States clinical experience. There are different types of clinical experiences. I'll share what are the different types, what you should prioritize. Then you have your OET, which is essentially a language exam. Because again, I understand that all of us are international medical graduates. So the sole purpose is to be certified with ECFMG, that is the Education Commission for Medical Graduates. So what you essentially need to show is that you are at par with all the medical students that are applying for residency, sports or residency programs all over the US, right? So in order to do that, you have to be certified by ECFMG. Then you take your USMLE Step 3. Again, we'll talk about visa types, but for J1, it's always better in like busy hospitals or hospitals that are very IMG dependent. You always have an upper hand if you take your Step 3. So it's always advisable that you take your USMLE Step 3 exam before applying as well. Then you have your ERAS application. This is the electronic residency application service. So it's all electronic. They keep changing it every year. I applied 2 years ago and I was lucky enough that I matched. Every year it keeps changing. They keep updating their minor tweaks, but essentially the gist of it, the main theme of it remains the same. And we're going to talk about it. Then we have the NRMP. This is the National Residency Matching Program. Again, there's an entire algorithm, how it works. We'll talk about it briefly. And one thing very important is your interviews. Definitely, not only do you have to score good, you have to make sure you have your research and everything, but you need to perform good in your interview, because the interview is what you call make or break, right? So if you do good in the interviews, number one, your purpose is to get as many interviews as possible. Then once you have an interview, you want to outshine to ensure that you're in the top of the program's rank order list, so that if you were to rank the same program, you match and essentially you start your residency training. Then there's something called the rank order list. We'll talk about that too. And finally is your doomsday, or rather I would call judgment day. That's your match day. So once you match, hopefully all of you will get the good news that you will match whenever you apply, either if it's for this year or if it's for the next year. Now let's talk about USMLE. Again, this is the United States Medical Licensing Examination. So like I talked about before, What this essentially is that you're taking the exams, the same exams that US medical students take to show, or to rather, in order to be certified with ECFMG, you have to take your step one and step two. So this is to ensure that, again, this is a equal level ground, regardless of what your background is, where what med school you came from. Have you graduated like years ago? You're a recent graduate, you're still in med school. You just have to take the exam, and the higher you score, definitely the better it is. But again, recently, more than a year ago, they've made step one pass and fail. There was this discussion recently if they were turning it back to scoring or grading, but even the latest news is that they're still going to keep the USMLE step one pass and fail. So step one, the first thing you need to do is you need to be registered with ECFMG. Now, this is actually a form. This is something called a pre-registration. So you register, you fill a form called 183. Again, since January 2022, so it's been more than 2 years now. So that it's been switched from a score to pass fail. The score first, the pass score was 194. Now it's 196. Now, again, because I'm from Pakistan, and I believe even in India, it's similar. In the Asian subcontinent, it's similar that we have med school is usually from between 5 to 6 years. So there's something called preclinical years, and then you have your clinical years, or preclinical subjects and your clinical subjects. So your step one, it's essentially your preclinical subjects. That is your genetics, behavioral sciences, biostats, and epidemiology, which unfortunately we're not very, these are the subjects I would say it's very different about how they're in the step exams, but how we study that back in med school, because we are mostly focused on the anatomy, biochemistry, physiology, microbiology, immunology, pharmacology, pathology, and then there's a little bit of psychiatry too. You have 280 MCQs. This is an 8-hour long extensive exam. You have 7 blocks. Each block is 40 questions, and you have 1 hour for each block. There is a 1 hour break, which includes a 15-minute orientation. If you skip the orientation, you have that additional 15 minutes. So during the pandemic, this was quote unquote disclosed that out of 280, actually 200 questions are scored and 80 questions are experimental, but you never know what question is being scored and what is experimental. So, and there's no negative marking. So you definitely have to try your best. Again, this is time sensitive too, because you have to be very sensitive about time. It's not like you have a lot of time. It sounds like it's a 7-hour, like 8-hour long exam, but 40 questions in 1 hour, with some question stems being pretty long, you have to make sure that you solve all those 40 questions. Again, when it used to be pass fail, this is my personal experience, I would say anything more than 240. My understanding is to this date, the self-assessments that you take on UWorld or the NVMe, those are still being marked, being graded. So if you have the higher the score, definitely the better your chances of passing. And I would really hammer this, that please take your time for step one. Do not rush, especially since it's become pass fail. So again, in the US, everything is very systematic and everything is very standardized. So only if you have a strong base, expect that you'll have a strong, the covering would be better only if the base is strong. So I would really emphasize that take your time for your step one exam, and because that essentially the basic sciences form your preclinical subjects, form the basis. They really link the 3 P's: pathology, pharmacology, physiology, and then that is how your clinical acumen improves, and your clinical your understanding of clinical questions really improves as well. So take your time. It's very variable. I've written 1 to 3 years. Some people might prepare it take time in 6 months, or they might pass the exam in like a year or so. Good. So again, everyone has a different journey. Please do not compare yourself with anyone else, but again, definitely the sooner you do take it, the better, and the higher you think your chances are of getting a higher score, the better it is. Then for your step one resources, now again, if people, because back home, the approach to training is a bit different, rather very different, especially in med school. It's very different as compared to what they expect in USMLE. So you have something called your boards and beyond, just BNB or Kaplan video lectures. People who are visual learners, I'd highly recommend to go for BNB. Then you have your first aid. This is what they call the Holy Grail. This is the main book. It's essentially prepared over the years. I think they've been preparing it since 1990s. This is anything that is in your first aid book, it has been in one form or the other. It came in the USMLE Step 1 exam, right? So every single word written over there, it's for a purpose. Again, there's no purpose of route learning. You have to understand the concept behind everything. Then there's Pathoma for visual learners. This is an excellent, this is a book as well. Dr. Abdul Sattar, he has really nice video lectures. I would highly recommend. It's a very, very good, concise book for pathology, good preparation for pathology, which is very heavy on your step 1. Then you have Sketchy, again for visual learners, for microbiology, people who like to watch videos. You can get the subscription. You have some few videos available on Facebook or YouTube too. Then for biostats. Now biostats, there's this person called Randy Neal. He has free videos on YouTube. He's an excellent resource for biostats and epidemiology. I highly recommend that you keep in mind your biostats comes in step 1, step 2, and even step 3, and his videos are useful till the end. Then the main question bank. So the thing about preparation is, no matter how much you study, how much you think you know, you won't really know how good your preparation is until you take these question banks, right? So UWorld is the main question bank. I was just reviewing yesterday. They've increased their question bank stem to more than 3,600 questions. I would really recommend that you get at least a 12-month or a 1-year subscription. Now it's up to you. This is a little bit detailed. You go subject wise or system wise. It's up to you how you want to do it. Subject wise means you want to only do anatomy, you want to do biochemistry for starters. Then system wise means, for example, if you say, okay, I'm going to do cardiovascular, so I'm going to study the anatomy, I'm going to take the biochem, the physiology, pathology, everything. It's a learning resource. Please keep in mind, although it is an assessment tool, but it's a learning resource. So do not get demotivated if you're not scoring that high. You're scoring close to average or less than average. Again, it's a learning resource. The more and more you practice, the better you're gonna go. The better you're gonna become. Try to do at least a block that is 40 questions a day with explanations. Some people do more, some people do less. Again, whatever you're comfortable with. Then you have complementary resources. I would say Ambus is a good question bank too. And then you have anything you don't understand, please search it on YouTube. I'm sure you'll get a good explanation, which will be curtailed to, or rather, it will be molded to what your learning methodology is. Then you have something called the NBME. So NBME is the institution, I would say, which essentially makes the USMLE exam. So you have the same people who make the exam. They've made these NBME forms. There are about 200 questions. Now it depends. Each year they keep upgrading the forms, try to solve the latest forms. And then you have your self-assessments. This is from UWorld, self-assessment 1 and self-assessment 2, 160 questions each. Again, these currently they have score predictions. So again, the higher your score is, the better your chances, so that you are reassured. Because again, in my experience and thousands of people who've taken the exam before me, the UWorld self-assessments and the NBMEs, they're very close to your actual score. But again, step 1 is pass, fail, take your time, try to be on the upper side of the spectrum. Then we have our step 2. So this is a test our clinical knowledge. Just a second. Yeah. So this tests our clinical knowledge. This is 5th year of MBBS back in Pakistan. Behavioral sciences, biostats, again, like step 1, but more focused on behavioral sciences. Then we have our medicine, psychiatry, pediatrics, OBGYN, and a little bit of surgery. This is anywhere between 318 to 320 MCQs. This is a 9-hour long, arduous exam. So 8 blocks, approximately 40 MCQs per block, and 1 hour time plus block. Let me just make sure that I add, we add everyone. Nobody's, kept wait. So 318 to 320 MCQs in 9 hours. Again, you have a 1 hour block with a 15-minute orientation. If you skip that, so that's adjusted in your 1 hour. You have approximately 240 questions which are scored, and approximately 80 questions which are experimental. We do not know what is experimental and what is the actual exam. So please keep in mind that So please keep in mind that you solve every question. There's no negative marking. Ensure that you solve every question. You can take, again, depending on how strong your step one knowledge is, your base is, the stronger the base, the lesser your time to, build the building on top of it. So 1 to 1.5 year, again, I would recommend take the U World subscription for at least a year. Now in step two, 240 plus is a safe score. Definitely, if you score 250, 260, 270, that's even better. But again, in my experience, I've seen a lot of programs. You talk about what filters are. They filter applicants out of if you have like scores less than this or more than that. But please, please, please keep in mind scores are not everything, as we will talk about. This is the thing about the US. It's not like if you have remarkable scores and you'll match. No, there's no guarantee. You have to make sure you tick all those boxes which we'll talk about. Okay, then we have the resources again. BNB is a good video lecture. They have good video lectures for your step 2 CK. Randy need an excellent resource for biostats, which will be useful for both step 1, 2, and 3. Then we have again a strong step 1 foundation. It really, really, really guarantees that you do good in your step 2 CK. Your UWorld is your main question bank. More than 4,000 questions now. At least I would advise take a 1 year subscription. It's up to you. Start with subject-wise, system-wise. It's a learning resource, not an assessment tool. The assessments are separate. So again, obviously, if you're scoring good, it means you're doing good. But what you want to see is progress. See, like, okay, you're doing questions. Are you understanding? You try to understand where is the examiner coming from? What do they essentially want to test you on the exam? What's the question? What is the question asking you for? And what did you think? Why did you take the wrong answer? Chose the wrong answer, right? Then there's this thing called Divine Intervention Podcast. I would recommend this for audio learners, people who want to run, who want to go to the gym or do something, and they think rather than listening to music, especially when you're anxious if the exam is close, I would highly recommend listening to the Divine Intervention Podcast. Then again, Amboss and YouTube videos, they're complementary resources. NBME, again, you have certain forms. There are about 200 questions, similar to the actual exam, not 100%, but very similar. And then you have your UWorld self-assessments 1 and 2. Again, these are good score predictors. So if your target is 250, 260, and you're scoring that much in these exams, it means that you're actually doing the right thing. And there's a high chance that you score or you achieve this. Clinical experience, USCE. So your ERAS application, it lets you upload you can upload as many letters as you want to, but you can actually forward to each individual program up to 4 letters of recommendation. So 3 is at least, you should have at least 3 letters of recommendation. Now there are different types of clinical experiences. I'm going in a systematic manner, starting from what's the best one. So sub-internships, these are the most preferred. Sub-internship, essentially what they are is they're very similar to what your actual, once you're in med school, right? So at my program, we have students from Columbia University and a lot of other med school students rotating at our place. So what they're doing is they're doing their sub-internship. So when you're in a medical, while you're still in med school, and if you get a sub-internship, that's the best thing. That's like the best type of clinical experience that you can get. Why? Because it's hands-on. You're just like the medical student. The best part is if you have access to the medical record, you can chart. Again, students are not allowed to, their plans are not decisive rather. Sorry. So you have to be supervised by a resident, but you get really good. You're really working like a resident if you get to do the hands-on sub-internship. Then we have something called an externship, which a lot of us international medical graduates are able to do. This is allowed only after you graduate from medical school. This can be externship. This can be hands-on, but rather I would say the most common that because again, a lot of us have already graduated from med school because we've had to, complete our med school. I understand that the exams in med school, they're different than what we do in the USMLEs. So this is hands-off observership. It is allowed only after graduating from medical school. So again, the best thing is getting a sub-internship while you're in med school. If not, you graduated, get a hands-on externship. I do understand it's difficult, but then observership. Something is better than nothing. Now there is another category. Number one is hospital based or clinic based. I highly advocate for hospital based rotations. I know it's very difficult, but it's doable. I've done it. Thousands of other people have done it. It depends on how much effort you put in, right? So hospital based, it's most preferred. It's most preferred in a hospital which already has a residency program, so that you get to connect with people. They know, okay, you're working, you're doing this, you plan to apply and all of that. And then you have your clinic based. It's usually offered by online third parties. I am not a big advocate of it, but again, if you have no other option, please do not turn down clinic based rotations too, because you have to have some sort of United States clinical experience. Then US visa, this is something about specific for Pakistan. Again, it varies from country to country. So depending on where your the consulate or the embassy is, you apply. I understand that waiting times are really long in the entire, like for all the countries in the world. So like in Pakistan, we have at least a 1 year waiting time. So plan in advance, right? Again, this is a tip that if you're applying, then you have to show the visa officer something, that why are you applying. So it's always better if you book the rotation, if you have a hospital letter, an invitation letter from a hospital, it's always better. Please keep in mind that you can only have hands-on exposure if you have not graduated, right? If you're still in medical school, then you have to show that you have sufficient funds for the trip, and you have to show that you have strong ties with your home country, because the intent is not to immigrate. It's just that you would rotate or do some, take your step 3, take your step 2, take your exam, do some rotation in the US, and then come back to your home country. And then you should not exceed the date which is mentioned on your I-90. Now, how to ace your rotations? Okay, now we all know that we're supposed to do rotations, right? But what we want to do is we want to make sure that we're making the most out of it, because sometimes the rotations can be costly. Some rotations are for free, but some rotations cost a lot. Regardless, you're putting in an effort, so you need to make the best out of it. Number one is do your homework, study about the rotation. What are their expectations from you? Always introduce yourself. Again, I know, like, I've been in your shoes. We're shy at first, because again, there's a cultural difference too. But it's believe me, most if not all people in the US, they really want to help one another. So always be nice. Try to show your enthusiasm. Ask your preceptors. In a day or two, it's enough for ice breaking. Then ask your preceptor, what do they tell them that you're here for? You want a letter of recommendation. What do they want? What do they expect you to do? Because that is what you're supposed to impress them. An impression, you'll only impress them by working hard. There's no shortcut. There is no shortcut. Then do case presentations, because again, once we graduate, sometimes we don't have the opportunity, or we're not fortunate enough to have access to the EMR. But I've seen people, including myself, utilize all the resources. Even if you have a few resources, you can literally make use of them. Try to present case. If you can't do charting, and you don't have full access to the EMR, you have colleagues over there who are very helpful, and they would let you use the you have partial, like you can use the EMR, even if it's limited, but get involved in case discussions whenever they're rounding. Try to speak to again, don't belittle anyone, but show that you're interested, and that ask your attending if they want, they can assign you presentations and you can present as well. Always be friendly and humble. This is something out of medicine. It's like a no-brainer. And then ask there's no shame if you don't know what to do, because again, this is a new environment. So always feel at ease, and try to talk to people, and ask them if you don't know what to do or you're not sure. Again, this is my personal experience. Medicine is a forever learning thing. I have, to this date, I'm learning something new every single day, and so are my attending. So humility goes a long way. Never be arrogant, and feedback. So really hammering feedback. There might be subtle things that you're not aware of that someone might not like. So especially your attending or your preceptor, ask them how you can improve. Letters of recommendations. Now, this is a good slide. There are four things that I would say letter of recommendation should have. Number one is your medical knowledge and application, which is like how were you involved in diagnosis, management, teaching, meaning learning in your case, communication. It's not only medical, like that is only 25. Please know that it's only 25% is of what you call bookish knowledge. The other part is how you present yourself, how you communicate with others, your work ethic. Are you punctual? Are you working hard? Are you acting like a sane human being would, right? And then your interpersonal skills. How are you able to work with your colleagues? How are you able to, how are you treating the paramedical staff? How are you treating your patients? Then you have your OET, which is the occupational English test. So again, this is a replacement for the Step 2 clinical skills, which has been suspended since 2021 January. This is required for your ECFMG certification. There are four components. You have reading, listening, speaking, writing. The last I checked, so you have to have a minimum of grade B. That is 350 out of, I believe it's 500 in all components. But in writing, even if you score more than 300 or more, you've passed the exam. You have your official OET sample test available on the official OET website. It's a good resource. And then you have a very good resource on YouTube, which is called, it's a channel called E2 OET. You can review that too. It can take anywhere between 1 to 2 weeks for preparation. Again, depends on your English language skills. So this is essentially how well conversant you are with your patients and the general population, because majority of the people speak English over here. Then ECFMG certification, again, like we spoke about before, things that you need for that is you need your step 1 result. You need to pass your step 2 CK. Then your MBBS degree or your MD degree, MBCHB, depending on whatever part of the world you are from. You take your OET, you're certified in that. So then there are pathways. There are different pathways. This depends on what you've done in your med school and what you've done after that. Just to summarize, pathway 1, anyone from the subcontinent. This is for anyone who has graduated med school and done what we call house job in Pakistan or internship in the other places. So if you've done your 1 year of internship and you've passed your med school, you're good. It means that you don't need anything extra. Then pathway 2, this was if you've not done the internship, there's a date for it, that if you've graduated before a specific date, but you've taken something called the OSCE or Objective Structured Clinical Examination, which is in the final professional examination that we have back home, then you'll also be permitted to, you can apply for ECFMG certification. Then we have other pathways, including pathway 6. So if you've not taken, meaning if you've not done your internship and you've graduated before a certain, there's a date, you have to be certified by at least 3 US physicians, meaning physicians who have been practicing in the US. There are forms for it. You get graded for it, and if you pass them, you upload them, then you can be certified. Then after you've certified with ECFMG, again, step 3 is not mandatory to be certified with ECFMG. But if you're in an IMG heavy program, the match is becoming more and more competitive each day, right? So the higher you score, the better, or rather, the more exams, that is, if you've taken your step 3, the higher chances of getting matched. So this is essentially a crux, summary of what you've done in your step 1 and step 2. It combines both of them, everything that you've done in med school, and after that, it's a gist of it. Genetics, behavioral science, biostats, epidemiology, your basic sciences, anatomy, biochem, physiology, micro, immunopharm, and pathology. Then you have your step 2 CK, medicine, psych, peds, OBGYN, surgery. This is a 2-day exam. This can only be taken in the US. Your day 1 is your foundations of independent practice. This is 232 MCQs in 7 hours. Again, you have the similar 6 blocks, approximately 38 to 39 MCQs, and you have 1 hour for each block. You have a 1 hour break. Day 2 is your advanced clinical medicine and CCS, which is computer based case simulation cases. This is about 180 MCQs and 13 CCS cases. You have a website. It's a very good website. Just use it. You'll understand how the system works there. This is a 9-hour exam. Again, you can take 3 to 6 months for preparation, depending on. I would really advocate to take the step 3 as close to possible to step 2 CK, because it's very similar to your step 2 CK. 220 plus is a safe score. Definitely, the higher you score, the higher it is. This is for step 3. Your USMLE Step 3 resources. Again, UWorld, your main question bank has more than 2,000 questions. I would suggest take a 6-month subscription. Even a 3-month subscription is good, unlike a 1-year subscription for UWorld for Step 1 and Step 2. CCS cases, the website I was talking about, it has more than 160 cases. It's very good. Randy Neal, he's useful till, I would say he's useful even in residency for your biostats and everything. Then have a strong Step 1, Step 2 foundation. YouTube videos are complementary. And then you have your self-assessments for score prediction. Now coming to the ERAS, which is the Electronic Residency Application Service. So this is an online residency application service. First thing is you get your token, you generate your CV. There are certain headings, they keep experimenting, they keep updating it every day. Number 1 is your membership, honorary professional societies, work experience. So 3 main things are your work experience, which includes your clinical experience in the US, but please do not negate what you've done back home. You can make it valuable depending on how you present it. Then your volunteer experience, your research experience, including your publications, and something very important is your hobbies and interests that can literally make you stand out. You have something called a personal statement, then LORs, the letters of recommendations. Again, like we talked about before, letter of recommendations from the US are always preferred. Then you have your medical school performance evaluation, your MSPE and medical school transcript. Once you've graduated, you should have all of this ready. And then you have your supplemental ERAS. Again, this is an update that the SOAP, in case you don't get matched, there's something called, or rather, sorry, my bad. This is a supplemental ERAS application. Every year they keep changing their signaling. You have golden signaling, silver signaling. That is just a little bit of more detail about how the ERAS works. Now, what a personal statement is, it should be a 1-page long. It's a summary of your journey to the day that you plan to apply for the match, right? So initially you start with an introduction, then your medical school, why you want to join internal medicine or whatever specialty you want to do, your professional skills. Then paragraph 4 would be your research or what you've done in the US, what you've seen in the US, why you want to join the program, and finally your goals for the future. So a 1-page long, 1 page is good. Don't, because there are thousands of applications, so nobody has time to read more than 1 page. 1-page personal statement is good, and it should literally reflect your personality. It should reflect your journey. ERAS, now talking about 2025, that is that is this year. For example, if someone, I believe some of you might have already applied. Maybe this is interview season, so you might be taking interviews, you might be getting more interviews. So the season began in June, on June 5. June 26 is when these tokens were available. Submission, there's a deadline. Always ensure that you apply before the deadline, and then May is when March is when you come to know if you matched or not, and May is when the season officially ends, and July is when you start your residency. June, July. Applying to programs. Now, as international medical graduates, I would say the average number of programs we all apply to, I would say, again, I do understand that funding is a big issue over here, but the more you can, spend money on, it's worth it. So applying, they usually apply to more than 150 visa sponsoring. If you're a visa requiring applicant, you have to apply in a visa sponsoring program only. Now, usually it's your job to research each program individually. Now, I would summarize this. There are 3 filters. Number 1 is your visa status. That is something you cannot change. If you're a visa requiring applicant, you only need to you have to apply to programs that sponsor visas, right? The second filter would be your scores. So on each program, individual websites, they have their set scores. I know it's not definitive. There's a lot of ifs and buts to it, but again, the higher you score, the better it is. So if you're fulfilling that score, please apply in that program because they would review your application. And last thing is your the year of graduation. Yeah. So the year of graduation is something that international medical graduates unfortunately struggle a lot with, because most of us, we come to know about US after we've done, like we've graduated, and then we're like, okay, what do we do now? So that is the purpose of this presentation too, so that people who are already in med school, who are taking their exams, they know, okay, what the journey is, so that, I can help you guys. I can kind of guide you guys that the sooner you apply, the better it is. A lot of programs have a 5 year of graduation cutoff, meaning that if you graduated more than 5 years, they would not review your application. But please, please, please keep in mind there are thousands of, hundreds of stories, examples, including in my program, where people have applied, where people have worked for more than, or have graduated for more than 5 years. But as long as you're clinically active, and how are you able to present that you've been active and you've been able to, do something useful that will help you in your residency, they can review your application. Then there are three types of programs. Number one is your university program, especially if you're interested in a research heavy or research focused program. University programs are good for that. Then there are university affiliated program, like my hospital, Harlem Hospital, which is a community program, but it's affiliated with Columbia University. And then you have your community program. Please keep in mind, regardless of what type of program it is, every program has to be ACGME certified. So there is a minimum criteria that everyone has to fulfill. So it's not like if you go in, it's the same residency structure. Yeah, definitely you'll be doing more research in a university program. If you're really interested in fellowship, you can start, your pathway would be set up for fellowship if you're in a university. But a lot of people from community programs, they match into fellowship. So it depends on how you want to utilize your time there. Then it's always advisable, please go for a single specialty. Some people make the mistake. They're all over the place. They're applying medicine, OBGYN, peds. Okay, good if you're interested in both medicine and peds, because your CV, your personal statement should all reflect your interest. So if your personal statement is reflecting that you're really interested in internal medicine, but if you've applied in pediatrics, that is, doesn't look good even at the table if they're looking at your presentation. Then best resources, you have My Eras. This is the official website, and you have websites like Residency Explorer and Frida, etc. Email programs. Now, this is a big thing. Literally, me and a lot of other colleagues I know, we send thousands of emails. You have to send thousands of emails to program directors and program coordinator, because you never know if the ultimate goal over here is that number one, they review your application, and number two, they send you an interview and an invitation, and number three, they rank you. How competitive the match really is. Now, for example, I talk about my own program. So each year we get more than 7,000 applications. The number of applicants, it keeps increasing. At least, they interview about 200 candidates out of more than 7,000 applicants, and they would only select 27. So only 27 people will match out of 7,000, more than 7,000 have applied. Now, this is, just a second, sorry. So this is just a gist of number of applicants and positions in 2024. This is the year prior to this year. So you can see, for example, in internal medicine, 10,000 positions were total offered. Out of it, there were 13,000 applicants vying for 10,000. Why I'm talking about internal medicine? Number one, it's my field, and number two, more than 50% of the applicants, international medical graduates, we apply to IM. So you see, out of this, it says US IMGs 1,000 matched, and non-US IMGs 3,000 non-US IMGs matched in internal medicine last year. So these are just some stats. This is from the official NRMP website, by the way. Why the US? Now, in the interview, they always ask, why do you want to do? So, one very common mistake that we all make is we just, for example, we just say it has evidence-based medicine. There's a lot of multidisciplinary care. I like the technology there. It's always, always, always better to give in personalized example. Now, for example, if you say evidence-based medicine, if you've rotated in any place in the US, you would know that if someone comes in with AFib, the first thing you need to do is figure out the CHA2DS score, right? Then your Has blood score. So that there are algorithms, not only that you're supposed to use them in your exams, but you use them in actual life. Then your patient-centered approach, there's a lot of joint decision making. So you can always tell in the interview that I rotated in XYZ here in the US. Over there, I noticed how not only were doctors involved in care, we had nutritionist, social worker, we have the PMNR, that is physical medical rehab, PT, OT, making sure that patients who suffered with strokes, they were getting the appropriate physical therapy or occupational therapy. Emphasis on prevention, and then your EMR. Again, if you're able to come to the US, do rotations here, you come with this mindset that you need to, a goal, you have to achieve a goal, and you definitely have experiences that would make them very personalized to you. And if you're able to convey them during interview, that would make you stand out. There are a lot of common interview questions. These are all available on the AAMC website. You can find them on Google too. Just practice them, but please do not make it as though if you like memorize the answers. It's very don't make them sound robotic. Make them sound natural. Definitely, again, have some certain points in your mind. Okay, this is what I'm going to speak about, and then mold your interview depending on how the person who's taking your interview is reacting. Then there's something like they always ask, like, tell me something about yourself out of medicine. So 2 years ago when I applied, again, I have a hospitality business back in Farmhouse. I have a huge social media following. So I was like, why not talk about it? And believe me, every interview I took, they used to specifically ask me about it. Like, how did you get into this? What was it about? And I'm sure they would talk about it. Okay, he's that applicant who has a business back home in Pakistan and all of that. So anything that makes you stand out, your hobbies, if you run, if you swim, if you run the marathon, which I really wish I could. So just tell them about it because it makes you stand out. Then common questions for the program. So now there are certain questions that they ask you, and then you definitely expected that you will ask the program some questions too, right? So ask them about their education, like do they have any teaching opportunities, any research opportunities? What are the clinical duties usually like? You can talk to residents. This is mostly what you talk about during residency meet and greet, or you can talk about this with the chief resident. And always, even if there's a question that you want to ask it in a positive way. Don't like, outrightly be rude to someone. So for example, there are some certain programs which are there. People think that there's a lot of what you call like non-medical work that you're doing. So you always ask the program, what is the program doing to improve its performance regarding that? And they'll be very open. They'll tell you that this is what, like they're trying to reduce cut work, etc., which has been the really, really a good, I would say, setup that my program has made, and it's really headed in the right direction. It's really improving on that. Know your program well. Do your homework. It's always good to research who's interviewing you, read about them, study about your program, including study about the program you've applied to, including the residents, recent graduates. What you want to show, what you want to tell them is why are you a right fit for the program. So if you're in a city like New York City, which has more than, I believe, 1,500 or 2,000 international medical graduates, so tell them that you have family over here, you're an IMG, you have patients from your population over there, so you can relate to them. So they really count that into. Again, taking step 3, it gives you an upper edge. There's something called post-interview communication. Always thank the faculty member who took your interview. Now, there are ifs and buts to it. Some programs like that you send thank you letters. Some do not. The program coordinator will tell you to read the interview. And there's no harm in requesting for an in-person rotation or a second look, especially if you've done a virtual interview to the program. And then you can always send your letter of intent. They're usually sent in February. Especially your top 3 programs that you really want to join, you send them your letter of interest to tell them that you really want to join so that they can rank you accordingly. Rank order list. Again, this is a list which opens in usually 1st of February and ends on March 1. It's you get something or you buy something called the NRMP token. So what this essentially is that programs make their rank order list and the applicants make their rank order list. What you want to do is you want to make the rank order list according to your preference. Don't think that if there's a program which like a very well-renowned program and you think you'll never match there, you never know. So always try to make the list, prioritize the programs you want to go to. Don't prioritize programs you don't want to go to and you think that okay, I'll rank them number one because I'll definitely match there. No, that's not how it works. So it's according to the applicant. The applicant has the upper hand over here. The algorithm runs on match day, which is Monday of the third, usually the Monday of the third week of March, and you'll get an email if you've matched or if you've not matched. Now, this is the email that I got back in 2023, and I'm sure that all the people who are listening here, this day will come for you too. You'll get this email, and again, you'll know that you've matched or not. Now, even if you've not matched, it's not the end of the world. There's something called SOAP, which is a supplementary, it's a supplemental pathway. It runs for 1 week. Realistically, very few international medical graduates match during this week, but there have been US international graduates and non-US international medical graduates. So it usually starts on a Monday, like 10 a.m. on 9 at 10 a.m. is, like everyone knows if they've matched or unmatched. People who've not matched, then there's spots which open on Monday, Tuesday, Wednesday. All the programs are reviewing and literally have your phone right next to you. You never know. You can get a call on your number that you've given on the ERAS, your CV. And then if you get a call, it's literally like you get a call or an email, they schedule a meeting, an interview. Sometimes it's an interview, sometimes it's just like they ask if you're interested and you might just end up matching. And then it finishes on Friday at 12 p.m. of the same week. Lastly, let's quickly talk about contacts connections, like we talked about at the start. Now, this is something that has helped me and has helped a lot of other people too. Now, please keep in mind when we say contacts connections, it's through hard work. It's not like, some people are of the concept that maybe if I know someone who knows someone, they would vouch for. Even if they were supposed to vouch for you, you have to have something on your table. You have to present some, you have to have something on your plate, right? If your plate's empty, nobody's going to vouch for you. So you make sure that you check all the boxes. Again, what are those boxes? Your step exams, you've taken them, you've scored good. The higher you score, the better it is. You've done your clinical experience, clinical rotation in the US. You've done your research, especially if you're really interested in research. Try to do more and more research. So these are a few things. And then your interview preparation. Your interview preparation is good. If you've ticked all these boxes and you have contacts, connections, that's always good, doesn't harm. So always introduce yourself. Okay, so the basics are the sooner you reach out to people, the sooner you reach out to residents, attendings, the better it is. It looks bad on the applicant side if someone was to, like email me or message me at December saying, can you vouch for me during this season? So the season has already started. The season starts in December. September. If you have an interview, it's okay. You can let them know that, I have an interview. I would be grateful if you could help me, or you could, like review my CV, personal statement. And please, please, please do not ask a random resident or attending. The first message and the last message you would want to send someone is that, can you please recommend me to your program? You don't know them, they don't know you, and all you're doing is just asking them, can you, like, if had you reached them before, told them that I'm applying to the US, I'm making my CV, writing my personal statement. Can you review it? Can you give feedback? That's the right way to do it. You have to prove your worth. You can always offer that you're willing to do a rotation in the US with a US physician if it's possible. Please, during your rotations, please talk to your fellows, talk to the residents, talk to medical students. Anyone can be useful, you never know. And please avoid asking personal questions. Like, it doesn't matter what my credentials are, what the attending credentials were, what the resident's credentials were. It does not matter. What matters is what you're doing and what your scores will be and what rotations you've done and how you present to yourself during the interview. Now, social media, you can literally use social media. I've reached out to people via LinkedIn, Instagram, Facebook. Now, Instagram is becoming a good resource for, you have a lot of like residents, including me, who have public pages on Instagram. You can reach out to them. Try reconnecting with people. So people you met in the US during your rotations, send them an email, send them a message. Again, it depends on how close you were during your rotation. If you've been a good person to them in the during your rotations, it can be helpful. Then you can always request your contact connections. Again, like I said, please, the best thing to do is to request them to review your CV and PS and ask for suggestions, ask for feedback. No harm in asking them to put in a good word for you if they know you at the end of September, because that is when the programs will download all the applications and the entire process will start. Everyone is really busy over here. Believe me, everyone is really busy. So you can always, please do not get disheartened. Once you come over here, once you start, you understand how busy it is. So please don't think that someone is ignoring you on purpose. It's just like they're really busy. So it's always, maybe give them a gentle reminder, a text or so. And if they review it, it won't hurt. And always thank your connection, your contact, no matter even if you didn't end up matching in the end, because you might need them. Maybe you need them in a few months. You might need to reconnect with them after a year. This is just a summary, because I know all of this can be very overwhelming, because what I want to do is show some statistics to you over here. This is from the official NRMP match. This is from the year prior, the last year's match results, 2024. So please note, every year, not only do the number of applicants increase, but the number of spots available increase in the. This is a good thing about the US too. So see how last year, if you were to look over here, according to the official match results, there were 44,853 applicants for a total of 41,500 positions. Doesn't sound a lot, right? Because I'm sure from back home when we applied for med school, that was more competitive than this. But it's just when you get into the system and you get into it, you realize that it's actually competitive, because this includes both the US medical students, MDs, DOs, as well as the non-US and US international medical graduates. So there were about 80% certified applicants matched to a PGY position. So 80% of the total applicants matched, and about 94% positions were filled. Now, this is something useful for international medical graduates. Now, if you are a US citizen and an international medical graduate, there was a 67% match rate, meaning 67% of them matched. Now, for applicants like me, and I believe most of you would be non-US citizen international medical graduates, 58.5. So this rounded up to like 60%, means there's a 6 out of 10 chance that you will match. I do understand there's a 4 out of 10 chance that you won't match, but look at the brighter side, there's a high chance that you would match. There were more than 1,100 certified new positions which opened last year, and more than 125 more certified programs. So again, the thing about the US is that they keep on increasing the residency spots. They keep on increasing the new programs which keep opening. Again, you have to do your homework to ensure if they're sponsoring visa and if you fulfill their criteria or not. Now, just all over the world, like you can see, J1 is the most common visa. There's another visa type, H1B, but most programs, including my program, they sponsor a J1 visa. So all over the US last year, there were more than approximately 3,000 Indian nationals who got the J1 visa, followed by Canadians at 2,800, followed by Pakistan at 1,500. So there's a list of top 10 countries with physicians with J1 using J1 visas or on J1 visas. Then you have state-wise, like, New York is a very international medical IMG friendly state. You have states in New York alone, there are more than 2,500, 2,687, including me, residents, including me, who are on J1 visa. Then you have Pennsylvania, Michigan, etc. And then there's this small graph. This is just an overview from 1992 all the way to 2023. So you see every year, US MDs have the highest chances of matching. Now, DOs are competing with them. A lot of DOs match too now. And just a second. And over here, you see non-US IMG is the orange curve. So you see there was a dip, but essentially what this means is that the chances of matching for both all MDs, DOs, USMGs, IMGs, and non-US IMGs is increasing. Now, lastly, I would say please keep in mind this is a sprint, not a marathon. So be patient. You would have high days and low days. You would have a lot of days where you'd be like really, feeling low or something, and you'd be like, is it really worth it? But believe me, it's worth the grind is worth it at the end of the day. And if you can dream it, you can definitely do it. If I can do it, so can you. These are some words of motivation, and that will be it from my side.
Leah Jeffrey. Okay, see, Taif, can you talk about red flags in match, like year of graduation, and how to overcome them and improve chances of match?
Yeah, that's a good question. Again, I do understand for some certain international medical graduates, again, like I told about their red flags. So, or rather, one big red flag is the year of graduation. There are a lot of programs who have at least 5 years of graduation, meaning that if you graduated past your 5 years, it's difficult for you. It's not impossible, but it's difficult for you to match. So how do you overcome red flags? That's the main question. So what essentially you need to do is you need to show them that you've been clinically active. What have you been doing since you graduated? I know people who start doing they get a J1 visa for research. They spend a year or two for research. So you can always join. Again, how do you do it? You send thousands of emails to different. You just type it on Google. US research positions available for J1 visas. So you get a long list, and individual email individual programs. The other thing you can do is if you have a valid US visa, you can always do more and more rotations over here. Try to tell them that like this is what you've been doing over here. Connect with people, make connections, make contacts, and other than that, what you can do is you can always if for some reason you can't come to the US but you've been clinically active back home, tell them that this is what you've learned, this is what the impact you've made, and that would count to it as well.
That what's the environment like with the supervisors? Are they more relaxed, or is it a stressful and high pressure atmosphere compared to Pakistan subcontinent?
That's a good question, Yusra. So, in all honesty, the attendings are very, very, very nice. Because why? Because they've been through the process. They know how arduous the journey is. They've been through, like, they've put in a lot of effort too, right? So, I would say, again, everything is supervised by ACGME. You can literally report anyone, and this is all anonymous. If someone is like really, like not following the guidelines, you can report them. But in all honesty, again, look, Harlem Hospital is a public hospital in New York. New York itself is very busy, and then public hospitals in New York, they're super busy. But my attendings are, in my personal experience and people I've talked to, they're very understanding, they're very nice. They know their job is, our job is to definitely take care of the patients, but it's a training program, so we need to be trained, and the job of the attending is to train you, and that is what they do. Sometimes it gets tough, I will be realistic. Sometimes it's like you're that you get overworked, you might get burnt out and everything, even during your USMLE journey. So there are days when you have your official ACGME sponsored wellness days. You can take a few days off, you have your sick days, and then you have your mandatory vacation period, at least 4 weeks. So all of that taking into consideration. But all in all, I would say the environment, depending on where you match, if you match in like a rural place where the patient, I would say the numbers are not that high, I would say it would be a bit more relaxed. But please, you have to be on your toes. Now, it's not like if you're relaxed, please keep in mind you're also being continuously, you're getting feedback, you're getting anonymous feedback, you're getting feedback too, you are being evaluated too. So try to put in your best, and just it's like a family. It's like all of you are in this together. So the faculty, the staff, the paramedical staff, everyone's really nice generally.
Is there an ideal format for MSPE for non-US IMG schools? As many of us don't have an MSPE system, it's more of a markship system with that word.
Yeah, so that's a good question too. So again, it depends on your institution. The best thing I would say in this regard would be, I don't believe there's a. I'd actually have to double check it, but I believe on the ECFMG website you can look it up if they're asking for a specific format. I think there are certain points that the MSPE has to highlight. That that there will be certain points that you have to ensure that this is what you've covered, what you've done in your med school. But the best thing would be if you have any alumni from your med school who matched in the US, because they would have a similar MSP from the same med school, so you can double check with them too. But I would recommend that search this on the ECFMG website if there's a pattern that they want. But I do believe that definitely would be some points that they want that should be fulfilled, or some points that should be highlighted in the MSP.
What is the work-life balance like during residency? Do residents get any regular days off or leave?
Yeah, again, good question, Yusra. So work-life balance, you have to make work-life balance. Residency is busy. No doubt it's very busy. So on paper, please keep in mind, on paper, you're supposed to work, like it says 80 hours a week is the maximum. That's the cap, right? So there would be weeks where on paper it says 80 hours, but you would be working more hours. But there are some weeks which are really relaxed. Asking now your question, if we get off. So at least at my program in Harlem, because it's a very busy program, it's a public hospital in New York City. So ACA regardless where you work, you cannot work for 7 consecutive days. You have to get at least 1 day off in 7 days. Right? There are programs where you have a lot of golden weekends. Back in my in my program during my first year, even the first year that I have right now, we get something called a golden weekend. That is usually during the clinic week. It rotates depending on if you're able to if you have that, so you get both the Saturday and Sunday off. It's usually after you do work for 24 hours on Friday, but so you can get a golden weekend. But you have at least 2 wellness days a year that you will get off, and you have at least 5 sick days off. These are paid, meaning that this is paid time off. And then you have 4 weeks. Most programs divide into 2 weeks of 2 plus 2 weeks of rotation, vacation. So you can get off of that. Work-life balance again depends on how you want to utilize your time. It's busy, but if you're interested, I am a very big proponent of getting yourself busy into something out of medicine as well, so that keeps your mind refreshed, especially if you're in a program which has a lot of IMGs like my program does. So it's good to talk to people, get to know them and all that, get a hangout. If you're in a city like New York, there are endless opportunities. I think like no matter what you do, you won't be bored.
I also hear about signaling gold, silver for programs. Could you also tell us about it? Thanks.
Yeah, so yeah, like I was saying, each year they keep updating this. At my time, they started with signaling, and now I've heard gold, silver signaling. So in all honesty, when I applied, I remember my program was not in the I understand that programs themselves voluntarily, or they volunteer if they want to be signaled or not. So I did not signal my program, but I ended up matching here, and I'm happy about that. But yeah, realistically, if you were to signal a program, that means that you're really interested in them. So again, you have to choose them very wisely. If you're fulfilling the criteria of a program, again, be realistic, right? If you're fulfilling the criteria, if you think that you're a good fit for a particular, you're a good fit. So if you think you're a good fit for the program, you do good in that program, and that program is willing to take you, I'd say definitely signal them. That would make an impact.
At what timeline is it okay to give USMLE Step 3 exam?
Yeah, so again, ideally, the best thing would be, because now what happens is that on the ERAS, the Electronic Residency Application Service, the result transcripts, your USMLE transcript, they get uploaded automatically, meaning that once you had it, it would be uploaded, if I'm not wrong. But the thing is, if the application season starts in like September, it's usually September 25 to September 28, 29, whatever the date between this. if you have the result before it, that's the best thing. Why? Because once you have it, and what happens is, like, let me just tell you something like really straightforward. There's something called a PDWS, Program Director Workstation. So when you're uploading everything on ERAS, on that particular day, whatever that date is, at 9 a.m., the PDWS has access. It's accessible to all the program coordinators in the entire US. So then they start downloading. It's like literally clicks away. They start downloading all the thousands of applications that they have. Like in my program, there's 7,000 applications each year. So what they do is they download it, and then they will start filtering them, meaning that they put in filters. Okay, if anyone has a step score of less than 240, we'll filter them out. If anyone has not taken step 3, we'll filter them out. Again, like my program, like other public hospitals in the US, IMG heavy, they prefer that step 3 exam already been taken. But in case you have not taken the step 3, I would advise, and you've applied, and you're only left with step 3, take the step 3 exam. Once the moment your result is out, email all the programs that you not only upload it in ERAS, but individually email the program directors and program coordinators of the programs that you've applied to. Share your transcript with them to tell that you've taken the exam and this is your score, and they would acknowledge it.
Me, how to get externship in USA as a graduate?
Yeah, so like I told about the rotations, this is like, again, sub internship is when you are still a med student in med school. Number 2 is either an externship or an observership. A lot of us get observerships. My suggestion would be, again, the category is either hospital based or clinic based, ideally in a hospital that has a residency program. So the best thing would be literally type it on Google, type the name of the hospital, try to find the email of the attendings, email of the program coordinator, and I literally mean I've sent thousands. When I say thousands, like it's thousands of emails to different programs, and all you need is a single email if they're willing to accept. Like my program personally, they've stopped. They don't allow observership. They don't allow any rotation since the COVID pandemic. I've heard this is a thing in the New York City Health and Hospitals, that they don't no longer allow rotations, because we already have medical students from Columbia and other med schools rotating, so we're already busy with them. But again, number 1 is email individual programs, individual attendings and doctors. If there's a hospital that has a residency training program, good. No, number 2 is an attending who is affiliated. Like for example, there are usually attendings who are affiliated with the hospital, with the residency program or with the university. So you can email them too. And lastly, which is not advised, but something is better than nothing. You can have these, and they're usually sponsored by third parties, clinic-based rotations. You can rotate in clinics. Again, what those clinics are, they are headed by attendings or physicians who have affiliation with some university or some residency program, so they can vouch for you. So that should be like your last priority, not the top priority.
What would you advise for an old IMG with gaps, could not avoid due to family issues, but did home opthal residency too, and now planning to apply to neurology and pursue neuro-ophthalmology fellowship? How to overcome my gaps and stand out among others? That's
Yeah, again, a good question, and something that is relatable to, I believe, other applicants too. So especially the fact that you've done an ophthalmology residency, that's a very strong point. Now, it depends if you've been active or did you take some breaks. You have to justify the breaks that you took. Even what is done, right? Now, what you have to focus is what you want to do from now onwards. So I would really recommend that neuro-ophthalmology, like you have a long-term plan, try to reach out to attend. A lot of things are available on Google, so try to Google the neuro-ophthalmology program, the neuro-ophthalmologist, the attendings here in the US. Try to get in touch with them if you're able to email them. Always show your enthusiasm. Tell them that this is what I've done, this is what I want to do, and again, ask them for their opinion, because some people will be like straight on, they'll tell you if it's possible or not, but there's no harm in reaching out to people. And please keep in mind, everyone is super busy. If they do not respond, it's not like they're doing it on purpose. Like personally, me, I have more than 80 messages in my request at Instagram. So again, it's not like I voluntarily don't want to reply to everyone, right? But I thought like a session like this, if I have all those people over here at one time, I would be able to answer them like this. So again, try to and again, if you're actively doing your ophthalmology residency, or you've done that, you're practicing, so you can tell them, you can show that you've been active, you've been doing that, and this is what you want to do in the US. So reach out to people.
Can we get any paid medical assistant or sub-intern jobs to support our journey? What type of visa is required for that?
Yeah, so Walaikum Assalam. So yeah, so the issue about this is that when you're on a B1, B2 visa, you cannot do any, like, you can't work. This is a tourist visa or this is a business visa. You cannot work. For that, you either have to be on a J1, or if you're a dependent, a J2, or if your partner is an H1B, you have to be on an AED or a green card holder, but on a B1, B2, you cannot work. So again, you would have to change your visa type for that. But there are medical teaching assistant jobs, medical assistant jobs, scribe jobs in like places like New York, even other places where you can work as a scribe. You don't get paid good for it, but people do it. Like if you want to do it, you can do it.
Hafsa Malik, in our hospital, we aren't allowed to choose house job rotations. Do you think it is seen as a red flag to only do few months of surgery house job and then proceed for USCE if I intend to apply IAM by March 26?
Yeah, again, a good question. This is, I think, relatable to both, people, all people of the subcontinent, especially people of Pakistan. So, house job is what you call internship, right? And now the thing is, if you have to want to practice in Pakistan, it's mandatory that you do your sub internship, or rather, sorry, your internship. But in for the US, you don't have to do your house job. You don't, because especially if you graduate after 2023, which I assume most of you people would be now. Some of you might still be in med school. So if you pass your step 1, step 2, and you've graduated, so you would be certified by ECFMG via the pathway 1. So for that, I would recommend, if you're sure you really want to pursue the US, it's okay, skip the house job. But please keep in mind, there's no harm in, it's always good to do house job, because you literally, your clinical acumen, your clinical skills improve. But a lot of people, including me, if you skip your house job or skip your internship, what you have to show them is what were you doing instead of that. Were you clinically active? Not only that you were taking your exam, were you doing anything? Were you in the US? Were you doing your rotations in the US? So no harm in, again, because my understanding is a few months, if you're not getting the license, if you're not getting the internship, like if you're not completing the internship, so you're like, in the middle of nowhere, like you have not done your rotation, your internship, and you've only done 6 months, so they won't even accept it. Then why do the 6 months? If you want to do it, then complete it, so that you have the permanent license to practice as well.
What if one has got interviews but yet hasn't got ECFMG certificate?
Well, you're a very lucky person, then very lucky applicant if you already got an interview without being ECFMG certified, assuming that you're an international medical graduate. So again, like we said, the math season officially, like the rank order list will be finalized by the end of February. So by then, if you've taken your step 1, you've taken your step 2, you should be, and you've taken your OET, fulfilled criteria to be certified by ECFMG, depending on what pathway suits you. Just get certified by ECFMG, because you have to be ECFMG certified before you start residency. You cannot start residency. And keep in mind, step 3 is not mandatory for ECFMG certification, but always good to take the exam too. So the take home point would be, just get certified as soon as possible.
Yes. So, going forward, we have one question from Teiram Aslam. So, what are some things I can do in my home country that would help my CV?
Yeah, so again, a good question. Like, again, if you're practicing in the home country, some people, they overlook it. Please don't overlook it. They really admire here in the US, because especially like in places like New York, where it's busy, just like we back home, but definitely we have a lot of resources as compared to, unfortunately, back home we don't have those resources. And then so tell them that this is what you've done. This is like you worked in a resource low environment with the population of patient heavy environment, and that you've really improved your clinical skills. That would be helpful. Volunteering experiences that can help, especially in like world renowned or international NGOs or institutions. If you work with them, that is good. And then you can always work remotely as a for if you are interested in research, you can reach out to people. There are remote research opportunities available. Again, it depends on if you're willing to make that effort or not. I think we can have 2-3 more questions and then we can close it off.
Yes, Doc.
Mm-hmm.
So we have another one from Ridima. And the question is, since your program offers J1 visa, as you mentioned, you have to go back to your home country after residency for at least 2 years. What do J1 residents do usually post-residency about this clause?
Yeah, that's a good question. Again, this is something after residency. So there's something called a 212E waiver. What that waiver essentially means is that either you go back to your home country, like you said, for 2 years, but most of the applicants, what they prefer to do is they do a 2 to 3 year waiver depending on what country you are from. Like for Pakistan, it's at least 2 years. You serve an underserved area, meaning that if you're not interested in fellowship, you just start practicing, you become an attending, you apply for the waiver, you go in any underserved that is designated by the US government. There are certain underserved areas. You become an attending, you practice over there for at least 2 to 3 years, and then you transition to H1B visa, and then finally the green card and all of that. So again, it depends on where you're from, what is the duration of that waiver, but generally most of the applicants, they go for the waiver rather than going back home.
I am a graduate IMG who wants to apply for DERM, and I have just started to study for USMLE. I want to find some research fellows to do while I study so that I won't have a gap year. Any tips?
Yeah, that's a good question, and being that's very you have to be very enthusiastic for dermatology, because dermatology is super competitive. Now you can look at the NRMP website. How many? I believe there are very few spots available. Number one for dermatology, and then if depending if you're a visa requiring applicant or not, and if you are a US IMG or a non-US IMG, if you're an international graduate in the first case. So very limited spot. It's not impossible. People have done it. People have done it in the past. So what you want to do is right now from the start, reach out to people. Ideally reach out to someone who's an international medical graduate and who's already a dermatology resident or has done their residency. So if you want to avoid a gap year and do some research, so literally start. The best thing is if you know people. If you don't know, look for people, search it on Google, find their emails. A lot of attendings have their emails. Attendings, usually physicians, they have their emails available online. So reach out to them and ask them and volunteer. Tell them that I'm interested in any, even if it's a remote research, and if they're interested in collaborating, and that is how you get the ball rolling.
Okay. The next question is from Irene, and the question is the number of LORs uploaded a strict requirement of programs during the match?
So the number of LORs, it varies. I believe you have to upload at least one LOR, but realistically speaking, because it's very competitive, there are thousands of other applicants, you should have at least 3 LORs. I think you can you can share 3 or 4, up to 3 to 4 LORs to. So some people, what they do is they have multiple LORs, and depending on what program they want to target, you can share that LOR to that particular program. But the more the number, at least 3 LORs is good, and ideally from US, from physicians in the US. So if you've done US clinical experience or US clinical education, the types of LORs too, I think they called it waived or unwaived. Likely the best thing is waived, meaning that you don't know what the attending doesn't share that letter with you. You don't upload that LOR. The attending uploads that LOR directly on the portal, and that makes it even more what do we call it? Like that makes it even more better, because it means that you're so confident in your work that you put in and the effort that you put in, that you're sure that the attending would have given a good LOR to you, a good feedback back to you. But you can always share with the attending that these are the points that, like what I showed you before: communication, your performance over there, your interpersonal skills. So you can tell them that if they could highlight that, and if they upload it, so 3 LOIs is good from the US, ideally.
Would you like to conclude the session by sharing some words of wisdom or a guiding principle that helped you the most during your journey, something that could inspire everyone watching today?
Yeah, again, that's a good thing that you asked. So, like, in all honesty, again, my purpose over here, like I said in the start, like I've been in your shoes, right? Like I've attended a few webinars before as well. Like I always used to think that will I be able to do it, because sometimes the journey looks really arduous, the journey looks really tough. So I recently went through this like post, I would say, on Instagram, and it was like, you have a journey, right? So this is about life in general. So we're always looking towards the goal, but try to look back and see what have you achieved to this day to come to in your journey. For example, if you're thinking, okay, I want to match, but have you appreciated yourself that you've taken step 1 and you've passed it? Have you taken time to appreciate yourself that you've taken step 2 CK and you've passed it? Have you taken your time to appreciate that you struggled so much that you came to the US, you did some rotations? Because again, it sounds very easy, but once you're in there, once you're in the journey, you realize that if it was that easy, everyone would have been doing it. But it's competitive for a reason, and it's on the top of, like, it's like it's a dream come true for people that they want to match into residency. So I'm pretty sure with hard work and true sincere effort, you put in your all, and then whatever superpower you have faith in, whatever thing you believe in, just put in your all, be sincere to yourself,